Hi, my name is Lynn. I was diagnosed with having PCOS, which is polycystic ovarian syndrome, when I was 20 years old. So I really didn't notice the growth of hair underneath my chin as I did over my lip, but what girl doesn't have a mustache? It started to get a little thicker over the years, and I would tweeze because I thought that would help. I would shave, and the other thing I would go to was Nair because Nair was a little bit easier and it kind of would even out the skin because shaving kind of just made it dry skin and ingrown hairs and stuff like that. So Nair kind of was the easier fix for me. So back in 2005, 2006, I started to do different options with trying to get rid of the hair. So I tried to do laser and it didn't work. Laser actually gave me a burn underneath my chin, and what I was told was that because I'm African American, laser was not the best route to go because sometimes the laser would get confused between my skin and the hair because they were both dark. So I went back online, did my research, and I was like, laser was not an option anymore, so I tried electrolysis. So I Googled electrolysis and I found Kelly. I first started coming to Kelly back in 2005, 2006, can't remember, but I remember how friendly she was and welcoming and telling me the different things and how long it might take me to get rid of some of the hair. But with the PCOS, it is a lifelong struggle, and she was telling me how that I will always probably have the hair, but with spironolactone, which is a medication that the doctor give people who are diagnosed with PCOS, it kind of reduces the growth of the hair. Along with the birth control pills and the spironolactone, it actually kind of helps reduces the growth of the hair. But I wanted to go off of the spironolactone without talking to my doctor, and I became a chia pet all over again. So Kelly noticed that there was a difference with the hair growing a little bit here, a little bit there, a little bit everywhere. And we had a conversation about how I need to stay on the spironolactone and continue to take my birth control pills and how that would help reduce, because going off of it doesn't necessarily mean that I would have a growth of hair that she'll be able to attack and get rid of. The hair will continue to be there. You know, even a hair that's kind of peach fuzz that's here, that's nice and pretty, it may become darker. So with Kelly's help, I'm no longer a hairy monster or a chia pet. I'm slightly hairy, but not as hairy as I used to be.